Imagine a 70-year-old man living in a rural village in Kenya. One day he suddenly falls due to a stroke caused by an undiagnosed chronic illness. Due to lack of continuous monitoring services and long distances to health facilities for continuous checkups, his conditions worsens and he finally dies. My company BENAD is building a digital bracelet for elderly people who are medically isolated and have chronic illnesses. This serves to help them predict potential health risks and call for emergency services using real-time AI-enabled sensory devices. BENAD exists because we believe that aging and living with chronic illnesses in rural areas should feel safe. But the problem is that around 50 to 70% of Kenya's elderly population lives in rural areas. In these settings, access to timely medical services is limited due to factors such as long distances to hospitals and a disproportionate number of health workers assigned in these areas. The challenges that the patients and their caregivers face is that firstly, there are no real-time alert systems to inform doctors or their caregivers when a medical crisis has occurred. Secondly, is that there's low internet penetration, where only 23% of Africans in rural areas are online. This means that most digital health services cannot work in rural areas because many of them rely on internet connectivity. Lastly, is that there's limited health literacy among the caregivers, who mostly consist of the patient's relatives. This group lacks adequate health information and first aid care information. My solution seeks to address all of these challenges with 4 of its core features: the offline device feature, automatic alert with GPS location, multi-sensory system, and an SOS feature. But how does it work? Let me show you. Firstly, the BENAD bracelet continuously monitors a user's vital signs such as their heart rate and temperature. This allows for chronic illness management. Secondly, the bracelet detects health emergencies such as sudden falls or rapid movements, indicating a medical crisis. When a patient is in need of urgent medical help, the patient can either manually press the SOS button to send out alerts for help, or in case of an incapacitation, automatic alerts are sent to the caregiver after a preset amount of time. Using an AI model, our solution leverages the patient's data collected through the sensors to detect and predict health complications before they happen, such as a stroke or a heart attack. This allows for early prevention and detection. I'm excited about the opportunity that Future Rise Incubator program presents in helping me transform BENAD from an idea to a tangible solution. Thank you.